Hello everyone and Namaste. I'm Nuthan Manohar, the adjunct faculty with the Indian Institute of Management Co-Recoder for Wellbeing and the founder of Me Met Me. And today, on the occasion of Cancer Survivors Day, I, on behalf of Times of India, welcome you all to the conclave, Living with Cancer, a journey that makes you stronger. Cancer is an ancient disease that even today strikes fear into our hearts, a diagnosis that can turn lives upside down. Hippocrates, the father of medicine, called it carcinoma, meaning crab in Greek, to describe the characteristic tumor which had these finger-like projections emerging from it. Later on, the Latin term cancer was used, a term that we're sadly familiar with. The condition affects all of us directly or indirectly, and its impact is undeniable. The incidence of cancer is rising at an alarming rate, with millions of lives affected worldwide. While India is not among the top 10 countries for the highest incidence of cancer, we still had 1.3 million new cases that were registered since 2020, according to the National Cancer Registry Program. But the good news is that with advanced research and development in the field of cancer, we've been able to have evolution in cancer treatment in the last few decades. This has greatly increased the survival rate of people living with the ailment and also has greatly impacted their quality of life. The idea behind the conclave today is to bring forth cancer survivors and the stories of their inspiring journey while shedding light on the latest advancements in cancer treatment, the importance of early diagnosis, supportive care, mental health of survivors, and more such insightful topics through multiple panel discussions. And today's discussion, the topic focus is on cancer research in India. Can innovation make treatment more affordable? Now, we all know that cancer survivors and their families have to fight battles which are physical and emotional. We also are aware that there is an economic battle, the battle of affording cancer treatment, the battle of affordability. However, major breakthroughs in the field of cancer research are expected to bring down the cost of treatment greatly. Our illustrious experts from Oncology ecosystem will guide us on how research and innovation can make cancer treatment more affordable. And with that, I introduce you to this wonderful panel of experts. We have with us Dr. S.H. Advani, the Director of Department of Medical Oncology at Jaslok Hospital and Research Center, and Mentor for Department of Medical Oncology at Sir H.N. Reliance Foundation. He's received Lifetime Achievement Award in Oncology 2005, Harvard Medical International, a Padma Shri by Government of India in 2002, Times of India Lifetime Achievement Award in 2018, Padma Bhushan by Government of India 2012, and has over 500 publications to his name. Dr. Advani ji, it is a delight and an honor to have you with us. We also have Dr. Vijay Haribhakti, the Director and Head of Oncology at Sir H.N. Reliance Foundation Hospital. His areas of exclusive specialization include head and neck cancer and breast cancer. His papers have been published with the American Journal of Surgery, Head and Neck, European Journal of Plastic Surgery, and the Journal of Laryngology and Otology. He has authored all chapters on head and neck cancer in the book titled Practical Clinical Oncology. He's also authored the textbook Resection, Reconstruction and Rehabilitation in Head and Neck Cancer in 2019. Thank you so much, Dr. Vijay Haribhakti, for being present here. We also have Dr. Sudeep Gupta. He is the Professor of Medical Oncology, Director, Advanced Center for Treatment, Research and Education in Cancer, Tata Memorial Center, Mumbai. He is also the faculty member in the Department of Medical Oncology at Tata Memorial Center since 2001 and is among the internationally renowned breast and gynecological cancer oncologists. He is also involved with 120 trials and published more than 250 papers in peer-reviewed journals. He is also the member of several national and international committees and task forces of DBT, DST, DAE, ICMR, NITI, ESMO, and others. Together, the panel of experts bring in a wealth of knowledge, experience, and compassion to this discussion on cancer. So thank you once again on behalf of Times of India. And with that, I would love to have this discussion open. Dr. Advani ji, I've often heard my parents speak that in their youth, the discussion about cancer or even the incidence of cancer was low. And on the contrary, nowadays it has become a discussion that is happening almost weekly. So is there an increase in the incidence of cancer in India? And what do you think are the reasons and how has it evolved over the years?
Yeah, I think there's no question that the cancer incidence is rising all over the world, whether it's Europe, US, or third world countries as well. In India also, we have seen a tremendous rise in the number of patients, both probably because of the reason that they are being diagnosed, as well as there's a true rise in the cancer which is happening. In Bombay Cancer Registry has clearly shown that breast cancer is increasing every year by 2%, which is a huge increase that we are really detecting. And this is more common in the major cities as compared to the smaller places like Sholapur, Barsi, and all the village type. So I think the lifestyle changes which have occurred in the cities, whether it's pollution, whether it's our habits, eating habits, and our regular exercise and all those things are really affecting the incidence of cancer, and therefore the cancer incidence is rising in a big way all over the India as well as world.
Thank you, Dr. Advani. So I think it's absolutely clear that there is an alarming rise in the increase of cancers, particularly breast cancer that he's mentioned. At this point, Dr. Sudeep, could you help us understand what are the ways that we could potentially reduce the risk of cancer? Is there anything we can do? For instance, Dr. Advani has mentioned about lifestyle changes. What is it that we can do? And what is beyond us when it comes to not getting cancer?
So first of all, thank you very much for having me on this distinguished panel. It's a pleasure to be here. With respect to how we could reduce the possibility of getting cancer, the three most important things are reduction or elimination of use of tobacco, which is related to a number of cancers and which is caught as a habit relatively early in life. The second most important thing that can be done is a reduction in overweight and obesity. You might know that obesity is linked to at least 10 different cancers. There is incontrovertible and excellent evidence to this fact. Some of those cancers include, for example, hormonal-driven cancers such as breast cancer, endometrial cancers, gallbladder cancers, and others. So reduction in obesity. And third, increase in the level of physical activity that all of us engage in, even independent of weight and obesity. So those are the most important lifestyle related factors that we can change in order to bring down the propensity to develop cancer. There are a few other things. It was shown that hormone replacement therapy in postmenopausal women was linked to an increase in some kinds of cancer, especially breast cancer. There is a lesser propensity to use that treatment now, although it can still be used in certain individuals. Breastfeeding reduces the risk of breast cancer. Having children at an early age reduces the risk of breast cancer. Reduction in exposure to carcinogens. And the most important carcinogen in our environment for a long time has been asbestos. And we have slowly phased it out, but it still lurks in certain environmental situations off and on. So some of those things can also be done in order to reduce the risk of cancers.
Thank you, Dr. Sudeep. That was
Thank you.
really, really insightful. At this point, Dr. Vijay, very recently I had read about the incidence of cancer among African American women because of the use of hair straightening products, which means that a lot of products that people use are also included in the carcinogenic category. So is there anything that you would like to recommend in terms of lifestyle changes when it comes to cancer? And the second I wanted to ask you about is about, is there a connection between sleep and cancer? Because India is known to be one of the most sleep deprived countries in the world. So is there a connection there as well?
So first of all, thank you very much for having me for this August gathering. And let me first echo what Dr. Sudeep Gupta said. I think we, as a matter of fact, at our own hospital just a few months ago, launched an important campaign called the SEEDS, SEEDS campaign, which I think makes it easy for people to remember. So I will say it out. The first S is shun tobacco. And by that, shun tobacco and all the chewing products, all these things that we see on the adverts and everything, all that is collectively harmful. And if that message can go out loud and clear to our population, that would be nearly 50% reduction in cancer and cancer-related deaths. So that is the magnitude of tobacco. So first is S, shun tobacco. The second E is eat right. I think we must understand the importance of correct nutrition, of including antioxidants, micronutrients, minerals, etc. in the diet and avoiding excessive use of saturated fats because they, in other words, are related to obesity and cancer. The next E is exercise regularly. This is something which everybody has said, and I'm going to echo, very, very important. The next is D, which is dump obesity and alcohol. When I say alcohol, I mean excess alcohol. And obesity, as Dr. Gupta very well brought up, is responsible itself for numerous cancers that we see. The final thing, and that answers your question, is stay vigilant. When I say stay vigilant, it applies to many things. We have to educate people about the important warning signs of early cancer, which they should be vigilant about. People should be vigilant about their own family history. For example, there are certain cancers, such as breast cancer, which can show a hereditary pattern in about 25% of the individuals, or even certain types of thyroid cancer, or often combinations of cancers such as endometrium and breast. So I think we need to stay vigilant about our inherent risks, and we need to stay vigilant about the factors that can lead us to an early diagnosis. Because let me tell you, I do understand the whole purpose of this afternoon's talk, but I must say, if there is a cost-effective way to controlling cancer, it is by prevention and by early diagnosis. There can be no question about it. Because when it comes to advanced treatment forms, well, whether we like it or not, yes, we can cut down on costs in various ways, but the cost, in fact, goes up when we are talking about new molecules. Now, to address your individual questions about the use of products, I feel, I don't want to create an excessive fear neurosis about the use of any and every product. We do know that there are certain benzene-related compounds that are there in some of these products, and they are not advisable. But I think we need to look a little deeper. If we find a greater incidence in African American women, it may well be due to their genetic predilection. So I think I wouldn't like to create any neurosis about such things. At the same time, lifestyle is important. We need to know the advantages of eating right, of eating good nutritious food, avoiding, if I may say, if you avoid everything that comes out of a plastic packet, you'll be doing yourself good, so you've got to avoid synthetic and food which is rich in saturated fats. It's only going to bump up your salt, it's going to bump up your fats, it's going to bump up your incidence of cancer, of cardiovascular disease, and of cerebrovascular disease. So the recommendations are quite common actually. What I said, seeds is common to whether it's cancer or heart disease or cerebrovascular, that is stroke. So these are common sense things which should and can be adopted by the general public.
Thank you, Dr. Vijay. That was tremendously insightful. And the acronym SEEDS, that's a very good way to think about how to live healthier. So wonderful from you. And with that, the question I have is to Dr. Advani, because you had mentioned in the past that, the incidence of cancer was lesser earlier. So what was treatment like, let's say, in the 70s or 80s? And what are the significant development in the field of medical oncology that has taken place in the last couple of decades?
Yeah, I've been in the medical oncology, I think, longest than many other people. And I've, had the experience of treating the patients in 70s and 80s. Looking back, I must say, how I was treating. I mean, it appears ridiculous that we were treating with very few drugs in our hand, very little information about the biology. And since then, every year the changes have occurred, and after 2000 the changes are happening every year, or even I would say every 6 months. In those days we had a very primitive chemotherapy agents, we were using it, and then better and better chemotherapeutic agents came up, and further better knowledge came up also, that we started using what we call it nowadays targeted therapies, where we are able to give the targeted therapies to target some substance on the tumor cells, and that's where you can have the best of the effect without increasing the toxicity. And then of course the new thing which has come up is the immunotherapy, which is also targeted, that we are targeting the immune system to go and kill the tumor cells. So I think all these progress which has happened has gone for a really good results. And because of all these things, our results have improved. So many conditions in oncology which have become curable. Today we can say that 80% of childhood cancer are curable. I think that's a big word. Some of the leukemias have become curable, like chronic myeloid leukemia has become totally curable. And also the development of support care has played an important role in the overall improvement. That today we can get the WBC count up with some small injections, we can increase the red cells and platelets, we can also replace the blood and blood products very easily, which are available. So I think the confidence in the support system, the newer and newer chemotherapeutic agents, the targeted therapies, as well as the availability of the immunotherapy, we have been seeing a changing landscape in the treatment of many cancers. So I'm sure each one of us have an experience that how we are seeing more and more cure. One example which I can give you is the lung cancer. In 1970s and 80s and 90s, we used to diagnose lung cancer. All the patients will go back home and with hardly any treatment. Those days there was no treatment. Today, many of these patients are surviving beyond 5 years. And some of them we feel that we are able to cure also. So I think that's a change which we have seen, and it's a sort of mind-boggling at all the changes that have occurred in the last 50 years.
Dr. Suresh, it's such a joy to be discussing with you, because you have seen history, and you are seeing all the changes that are happening as we go through it. So thank you so much, Dr. Advani ji. Dr. Vijay, we've discussed about, say, from shifting from limited chemotherapy agents to a multitude of chemotherapy agents. We've also touched upon immunotherapy as well as targeted cell therapy. Could you shed some light onto how has this impacted on reducing the cost of treatment, and anything that you would like to add on breakthroughs that has happened in treatment?
So honestly, if you want to know what breakthroughs in surgery, because that's what I would be more qualified to answer, I think undoubtedly the most important breakthroughs in surgery, I think, would pertain to three areas. We have seen a vast increase in the use of minimally invasive surgery. We are seeing much more of minimally invasive methods. Number two, we have seen and witnessed how robotics has, in a very big way, kind of revolutionized the treatment of many cancers, and that I would put laparoscopic and robotic surgeries in one basket. And thirdly, I think surgical advances that have resulted in vastly improved quality of life. This was, in fact, the reason why I wrote my book on reconstruction and rehabilitation, because what we find today is, as Dr. Advani said, the way we used to treat cancers before, patients with head and neck cancer were frequently oral cripples. They were crippled for the rest of their lives, and today we are able to give them quality. They can have a face that they can show to the world, and they can go back to their workspace and be productive. So also in breast cancer, we are increasingly doing breast conservation surgery, and we are able to offer whole breast reconstruction, thereby improving vastly the inner quality of life of women who are so frequently affected with breast cancer. Now, coming to what you said about how have the use of so many, as Dr. Advani mentioned, the use of so many agents impacted us, I think very importantly, because today, mind you, we function as a team. In fact, every single patient we treat is put through what is known as a multidisciplinary tumor board. All three, that is medical, radiation, and surgical oncology, along with radiology and pathology, we sit together and analyze how best can a patient be benefited, and we do it accordingly. I think Dr. Advani and Dr. Sudeep Gupta would agree that there are so many instances in which we bring together our respective areas to bear in the care of a patient, and thereby improve not only quality of survival, but also very often the duration of survival, which is a very big thing. So I think all these factors are interrelated, and I think the team approach has become very common, and we are happy that we give to the patient our best. In our hospital, our first value is patient first. So we want to make sure that every patient gets the benefit of all consults and all minds working together, so that we can give them the best that is available.
Thank you, Dr. Vijay. Advancements in surgical technology, as well as the shift to a team approach to looking at patients, I'm sure with that, definitely the quality of life has greatly improved. So thank you so much, Dr. Vijay, on that. Dr. Sudeep, considering the current times where everybody's talking about ChatGPT and AI, has there been any advancements because of artificial intelligence into cancer treatment?
Right. So let me begin by saying that artificial intelligence is extremely promising. I think it will change the way we treat many different cancers in the years to come. We are just beginning to see the results of the first wave and generation of AI technologies on cancer. In Tata Memorial Center, my colleague from pathology, Swapnil Rani, and I are the principal investigators of what we call the Imaging Biobank study, which is funded by the Department of Biotechnology, the Government of India. And what we are doing is to create an image bank, an annotated bank of images of both radiology and pathology images for 10 different cancers linked to their outcomes and linked to their clinical data. And this bank of images is going to be available to all researchers within India and even outside of India. So some of us who know a little bit about artificial intelligence, there are deep learning techniques such as convolutional neural networks, other neural networks. So what will happen, what is beginning to happen is that human expertise is being replaced in the so-called mundane tasks such as reading mammograms, such as routine reading of pathology slides, etc., and so on, by a first pass through the AI technology, and then of course the final determination of the diagnosis is made by the human expert. There is one more area where artificial intelligence is beginning to make an impact, and that is big data. So as you know, that there is data that is lying in the records of thousands of hospitals all over the world, and this data is extremely valuable, but it has never been aggregated together, or even if it has been done, it has been in fits and starts. So what is beginning to happen is that artificial intelligence techniques are being brought to bear on the records of literally millions of patients. And through the use of AI technologies, there is what we call the generation of real world evidence as to which treatments benefited the patients the most. So we are beginning to see the impact of artificial intelligence technology beginning in specialties such as radiology and pathology that are imaging based, but also in cognitive specialties such as mine and others, where decision making will also be increasingly assisted by artificial intelligence. I just want to make one comment on the team approach which Dr. Haribhakti alluded to. In my opinion, that has been the single most important advance in the past 15 to 20 years in the treatment of cancer. So earlier when I was training, it was beginning, these tumor boards were beginning to be developed, but they were not fully fleshed out. Now, all patients are routinely seen by an array of specialists. And by that, I don't only mean radiation oncologists and medical oncologists and surgeons, but we also have pathologists, imaging specialists, nuclear medicine specialists, rehabilitation experts in the team. And I think that has been the single biggest advance that has happened in the treatment of cancer in the past few decades. There are technological advancements in each of those specialties. So pathology is far more sophisticated than what it used to be about 25 years ago. There is use of immunohistochemistry, there is use of next generation sequencing technology, polymerase chain reaction, other kinds of molecular biological techniques to exquisitely accurately classify and diagnose cancers and put them in the right category for them to be treated. I think Dr. Advani mentioned that the treatment of lung cancer has been completely transformed in the past 20 to 25 years. At least a part of the credit for that transformation has to go to technologies such as molecular biological techniques that have been able to subcategorize lung cancer in appropriate categories, each of which has a different targeted treatment. So similarly, radiation therapy, and none of us is a radiation oncologist here on this panel, but radiation therapy has become far more sophisticated. We have advanced forms of linear accelerators. We now even have particle beam therapy such as proton beam therapy, etc., and so on. And the idea is to be able to treat patients in a more focused manner, in a more targeted manner, so that the highest possible dose of radiation is delivered to the tumor with the least possible dose to the surrounding normal tissues. So all of this has resulted in a betterment in survival outcomes, but also a reduction in toxicities and reduction in both the early and late effects of treatment. And I truly think that the care of patients with cancer has been transformed because of advancements in all the disciplines that I just mentioned.
That was totally detailed. So thank you so much, Dr. Sudeep, over that. But the question remains is because I can see that a lot of research has gone into changing how we look at treatment, how we look at surgery, and also within the medical system, also looking at, say, the tumor boards to make sure that a patient gets access to various doctors. So I'm kind of wondering, how does the cost go down? So if you could give us some insights in terms of how it was earlier vis-a-vis what is it now for a patient. Is it because of early diagnosis that the cost of treatment for a patient goes lower, or how does that actually happen?
So let me say, everything is not rosy, and no panel discussion can claim that everything is hunky-dory. I have to admit and confess that on an average, the cost of treatment has actually gone up rather than gone down. And I think Dr. Haribhakti made a very important statement right in the beginning of this panel, that the only way to treat cancers in a more cost-effective manner is to diagnose them early, or even to prevent them, in which case you don't need treatment at all. Once you already have a well-established cancer in stage 2 or stage 3 or stage 4, then because you have so many more imaging techniques, PET scanning was not there 25 years ago, now PET scanning is routine. There is an array of targeted treatments. Many of them are quite expensive. Many of them are on patent. So, the cost of treatment has gone up when you require to use those drugs. The occasions and the instances where the cost of treatment has actually been controlled and gone down is precisely in early stage cancer, where you now require possibly less intensive chemotherapy because you've been able to classify the tumor better. You've been able to catch it at an early stage. And I will just give you one example. This is a study that was led by my colleague, Dr. Rajendra Badwe, who is also the director of Tata Memorial Center. And it has just been published in the Journal of Clinical Oncology a few weeks ago. This was an injection of a drug called lidocaine. Now, lidocaine, many of us know, is a local anesthetic agent. It costs only about 40 or 50 rupees a vial. So what we did, this is a study that was led by Dr. Badwe, is to inject this local anesthesia around the breast cancer tumor just prior to surgery in half the patients. And in the other half of patients, they underwent the treatment without this injection. And the survival outcomes suggest that the outcome of patients is the cure rate has been significantly better when you use the local anesthetic agent infiltrated around the tumor. Now, this is an exemplar of research that is cost effective, that can immediately be implemented, requires very little expertise, and will help in the outcome of patients. The other study that I just wish to share with you is a study of a drug called carboplatin in a type of breast cancer called the triple negative breast cancer. Now, this has been used in advanced stage triple negative breast cancer for a long time, but we performed and reported at the San Antonio Breast Cancer Symposium the results of a randomized control trial where we showed that the overall survival of patients, of younger patients less than 50 years of age who were given carboplatin, who had triple negative breast cancer, was much, much better cure rates as well as overall survival compared to those who did not receive carboplatin. Now, carboplatin is a drug that per cycle will cost about 1.5 or 2,000 rupees. So this is something that will improve the cure rates at a cost that is affordable to the society, that is affordable to the payers such as the Ayushman Bharat and other various government schemes that pay for these treatments, and which will result in cost-effective improvement in the outcomes of patients. As soon as we have advanced stage disease, the cost of treatment has actually gone up rather than go down. But I would love to hear the opinion of my colleagues on the panel.
I agree with everything Dr. Sudeep Gupta said. I would like to put it this way so that it doesn't, it puts it into perspective. I look at it this way, if you have saved a life and you have restored productivity, then you have saved, I think, because there might have been an initial investment in treating that patient, but if you are able to restore life and productivity, you are ultimately gaining. And I think we have to think that way, because let's face it, any new treatment, especially new molecules like immunotherapy and all, they are very expensive, and we cannot stay away from them in our country any longer. If it is important and if it is making a difference, we need to find a way of using it and bringing it to our patients rather than all the time talking about cost. Because if it saves lives, then I think that is a cost well justified. I only want to say that because, we are always affected by this guilt complex about, okay, treatments are becoming expensive. But just think now if a person, we have to remove half the jaw in an operation, yes, reconstructing it will mean 8 hours more of surgery and maybe a few lakhs more in terms of the cost of treatment. But then the man has a face that he can show to the world. He can eat, he can chew, he can live a normal life. And I think is a saving. We have to learn to look at it correctly.
Value life.
Yeah. So quality.
Absolutely, Dr. Vijay. I mean, I think you put it very much into perspective, because in the past, yes, maybe the cost of treatment as such was a bit lower. However, the treatment was such that, the person would be left a cripple. There's a good chance that they would not recover completely. But nowadays, with the kind of treatment, the advancements that are there, a person is able to get back to life to its fullest. And that actually is what is costing, what is, justifying.
Since you said that you wanted real life examples, I'll tell you, when I started my residency at Tata Memorial Hospital, and I'll never forget this patient. There was one very young lady. She was 20, all of 2021. She had a very odd early cancer of the upper part of the food pipe, and she had what is known as a total esophagectomy. At that time, there was no microvascular reconstruction. That lady remained in the ward for 6 months, and she underwent innumerable operations, and at the end of all those, she could just about swallow liquids. Today, with microvascular reconstruction, a patient like that is restored in 1 week. So I'm telling you, the differences are dramatic, and that is what I want to say. Yeah, so that's where we are. Yeah,
absolutely. Dr. Vijay, at this point, you had briefly mentioned about robotics also. I would love to know a bit more about the changes in robotics when it comes to surgical oncology.
Oh, yeah. So see, I'll tell you, there are certain areas where robotics has made a very big and a very important contribution. For example, I think when I say GI, I mean surgery on the gastrointestinal system. When it's large intestinal tumors, colonic tumors, there is no doubt at all that the results following robotic or laparoscopic surgery are absolutely equivalent to those of open surgery, which require large incisions and a lot of time. These produce much quicker healing, much less pain, and so these are considered the order of the day. Also, an important thing in certain tumors of the rectum, we are now, with the use of robotics and the use of staplers, are able to operate on very low tumors and save the patient's normal fecal passage, which is a very, very important thing. A very low anterior resection, which was very difficult or impossible to envisage in earlier times, is possible today thanks to these advantages. It has also made a very, very big difference to certain types of surgery on the thorax, on whether it's lung or the food pipe, esophagus. Just imagine not having to do a great big incision on the chest and breaking a rib and getting the chest open, and doing it robotically, minimally invasive, has reduced the operative, post-operative stay, the pain, and so many things. So I think robotics is here to stay. There is no doubt at all. In urology, it is all robotics. Whether it is surgery on the prostate, radical prostatectomy, surgeries on the kidney. Today we can do partial nephrectomy, there is partial removal of the kidney, all that with robotics. So I think, although yes, there are many people who are critical about the costs of robotics. Once again, I am of the belief that you have to look at the advantages in terms of patient recovery time, in terms of avoiding pain and quicker return to normal life. I think robotics is there and it will keep on increasing. Yeah.
Thank you, Dr. Vijay. Dr. Advani ji, could you kind of help us understand a bit more about changes that has happened in terms of chemotherapy? You had mentioned about limited number of agents to a whole host of, agents that you can choose from. So if you could give us some insights into it. And has the presence of so many agents decreased the cost of chemotherapy, or has it increased it? And what are your thoughts on the future when it comes to chemotherapy and cancer treatment?
Yeah, I think the most important thing to remember is that we have a large number of different agents, whether it's a cytotoxic, chemotherapy, or targeted therapy, immunotherapy, a huge number of, sometimes we wonder which one to pick up, because in certain conditions, everything works, but then we have to think which one is the best among them and use that sequence. So that's a major problem that we are facing just now. So in other words, we have seen the progress, revolution, actually I would say, that something which we could never imagine before, and that is happening today. Who thought in 1980s and 90s that lung cancer we'll be treating with a simple tablets? But that's what is happening today. As far as all these developments have occurred, they have occurred all over the world. And I think all this research which has been happening has not happened with a single stroke of discovery. I think this is a very important thing to remember. All of us must remember. There's no single stroke of discovery that has changed the cancer treatment. It's a small discoveries, small information, small knowledge about the biology of the disease and how the tumor is different from the normal cells, that scientists have been able to develop the newer approaches, and ultimately it becomes a systemic, a very organized treatment. So that is what has really happened in terms of the treatment and the outcome. As far as the cost is concerned, I think that over a period of time, when the new drug comes up in the West, obviously they keep it at a very high price. But over a period of time, the patent goes away, and then our industry, pharmaceutical industry in India, is wonderful. They have provided us all the drugs which even many other people outside cannot get it. You must remember that. People in the West also, sometimes they come to India because it's so cheap over here. So I think our pharmaceutical companies, I must give them the credit for them, that they have been able to provide us with all the newer drugs once the patent goes off. So I think that's an important thing, that world over changes are occurring. And I can tell you very easily that in acute lymphoblastic leukemia, which is the childhood cancer, we used to treat them before. One, the results were not very good, and second, it was very costly. I remember one of the small simple injection, vincristine, in those days used to call 400 rupees. Today, that vincristine is available as 20 rupees or 30 rupees. And the whole treatment for the acute lymphoblastic leukemia can be really very short and very sweet, and majority of the patients get cured. In other words, over a period of time, some of the drugs have become very cheap. But the problem is with the newer invention. That's where the whole problem comes up. That each one of us, we feel that we have a full right to treat with the latest technology, latest information, latest knowledge to each one of our patients, which is not possible. It's absolutely not possible to give high technology treatment to every patient that we see. That is not possible anywhere in the world. Remember that. Even in UK, they don't receive the CAR T cell therapy, which is cost quite a lot. So I think we have to understand and accept that. Even if we are able to give to those who can afford or those who can come up with some, I think that's a good enough job that we are able to do it. And government also is trying their best to help, and they have a lot of setups where they are providing the free drugs, they are providing expertise. So overall, I feel that India has remarkably improved in terms of the cancer treatment delivery at a reasonable price. So I am very happy after 50 years of this practice that today I am seeing that most of our patients are receiving good treatment, which was not possible 50 years ago. 50 years ago, it was a rudimentary treatment available to very few people. Today, with a full treatment for acute lymphoblastic leukemia or Hodgkin disease at a very reasonable rate, cheaper than the tuberculosis. So I think that is what is really happening.
Thank you, Dr. Suresh. I mean, that was really insightful. I mean, you really brought in the point of how altruistic the government as well as pharmaceutical companies have been, and therefore being able to make the medication and the treatment affordable vis-a-vis, many other developed countries. So I think we do have an advantage when it comes to treatment, but then you are absolutely right. No matter where you are in whichever part of the world you be in, it might be difficult to get the latest technology and latest treatment based, at a very affordable price. So thank you so much for those insights. And I have one little googly for you, because you had mentioned about incremental changes in cancer treatment. What is your take on cancer vaccinations? Do you think that's a possibility in future so that we can prevent cancer?
Yeah, I think cancer prevention, all of us have been discussing all the time, and the incriminating substance or whatever, like habits, we have to stop tobacco, we have to get the adequate, better balanced diet, we have to exercise better, and also I must say that one of the cause of the breast cancer increasing in the incidence is that ladies are getting married late, they are having the first child late, and I'm told that in US, the first child in another 3-4 years will be born when the lady is 36-year-old. Remember that. And we all of us know that those ladies who marry before 25 and have the first child before 25, the incidence of the breast cancer is almost half as compared to those who are above 30. So I think that just indicates that we have to change our pattern of living also. So I think these are the areas where a lot of work has been done, but in spite of a lot of work, in spite of all the information, all of us know, everybody knows that tobacco is bad, but there are still people who are smoking.
Absolutely. I mean, more than vaccinations, I think if we can actually follow lifestyle interventions so that which helps us prevent cancer, that might be the direction to go. And that includes hormonal health and indications of, it's how hormones might be different at different particular ages and which can lead to cancer. So thank you so much, Dr. Suresh, for weighing in on that. Dr. Sudeep, I have a question for you, because we had touched upon governments and pharmaceutical companies and how they have impacted, say, cancer treatment. What about when it comes to research? What challenges do India face when it comes to cancer research?
Thank you for asking me that question. And before the challenges, let me say that despite the odds, India has produced a reasonably good output of research in cancer, both in terms of basic and translational research as well as clinical research. Coming to the challenges, I think the biggest challenge is how do we create consortia and groups that will work together on research protocols so that the outcome is achieved earlier and in a more reliable fashion. So let me give you examples. In Tata Memorial Center, in the past 10 years, we have about 15 to 20 big impactful trials that have been presented or published in the best journals of the world and presented at the most impactful conferences abroad. And they have changed the practice of treating cancer not only in India but worldwide. But the problem with such trials is that they were single center trials. So the one that I presented at ESMO in 2017 on cervix cancer took almost 15 years to be completed. Now, if we create groups that can quickly accrue patients on our clinical research protocols and clinical trials, ask good questions and answer them quickly enough, then actually we will achieve those advances much earlier. And here, in my opinion, the single biggest challenge is how to bring the private sector into the ambit of clinical research. Because the private sector, and Dr. Haribhakti and Dr. Advani both belong to the private sector, they provide top-class clinical care. But until now, most of the research that has been done, at least the impactful research, has been done at public institutions and government hospitals. But a large proportion of cancer patients in India are actually treated outside of the public hospitals and public sector. So I think one challenge is how to get a so-called public-private partnership in conducting cancer research, and then so that we are able to do research that is representative of the entire spectrum of our society, as well as achieve the results quickly. The second challenge, from my point of view, is dedicated funding for doing clinical research. So there is reasonably good funding that is available for basic research to basic scientists, as well as for translational research, such as the ones that are done in the laboratories. But cancer is a longitudinal disease. If you treat somebody with the research protocol today, or with cancer treatment A versus cancer treatment B today, the outcome will not be apparent after 5 days. The outcome will be apparent after 5 years, whether the cancer came back or did not come back in that individual, and similarly in the groups of individuals. So there needs to be dedicated funding and mechanism to be able to accrue a large number of patients on clinical studies, which in the ideal situation should be collaborative in nature. And Dr. Advani mentioned the advancements in pediatric cancers. And that has been the poster child of success in oncology, where the cure rates are now upwards of 90% or even 95 or 98% in certain cancers of children. And Dr. Advani is witness to the history that at one point of time in the 1960s and early 70s, the cure rates in the same group of children was like 15% or 20% or maybe thereabouts. Now, the reason why such rapid advancements were possible was because there were cooperative groups that rapidly, enrolled children onto clinical research protocols and then improved one protocol after the other, so that the outcomes were improved. And some of those protocols were performed under the leadership of Dr. Advani when he was in Tata Memorial Center, such as the MCP protocol for lymphomas and leukemias and others. So I think the challenge from my point of view is to conduct clinically relevant research in cancers that are common to India or unique to India, and to bring everybody together so that we can conduct research in a cooperative manner, and to have dedicated funding for that research so that we see the results in a reasonable time frame. So I don't want to sound pessimistic, but I have to say that we have a long way to go before we achieve this goal. And in Tata Memorial Center, there is one initiative called the National Cancer Grid, which has more than 250 organizations, both public and private, as members. And we are hoping that we will be able to bring everybody together. And this is not just Tata Memorial Center, this is all those organizations together constitute the National Cancer Grid. And so that we are able to conduct meaningful research. But I think we will be there in the next 5, 10 or 15 years. We are already there in many respects. There are a number of good studies that have been published from India, from many different centers, and hopefully we will make an impact also in the near future.
Dr. Sudeep, with your permission, if I may summarize your wish list, it would be public-private partnership in terms of research and dedicated funding for longitudinal research, so that we can actually look at all aspects, all stratas of society, and see how the treatment has impacted lives in a longer term. So thank you so much, Dr. Sudeep. That has been really insightful. And yes, you are absolutely right when you say that cancer is a huge challenge, but let's be optimistic, because I think what has happened in the last couple of decades has been like an exponential growth. So thank you so much, Dr. Sudeep there. And with that, I have a question to Dr. Vijay. Dr. Vijay, if you were to add on to this particular topic, what areas would require further investment and research in terms of cancer treatment in India?
Yes, I think I certainly can, and I think let me add to what Dr. Sudeep Gupta said. I think he's right that insofar as till now the private sector has been largely focusing only on delivering treatment, but now institutions, for example ours, are increasingly focusing on research. We have a separate department, we have a separate individual anointed for clinical research. We have an ethics committee, so we have the full setup, and I think we can the possibility of a partnership, say with Tata Memorial Hospital, for some of our important burning areas is very real. And since you asked me, I'll say one which is really top of the mind for me, and that is advanced recurrent head and neck cancer. Mainly cancers of the mouth, when they come back or when they are advanced, they are particularly difficult to control, to treat, to cure, and that's a question which needs to be answered. And I know that there are trials on at Tata Memorial Hospital, and even we have been writing down our own protocols, and I think that would be really a great place where we can hold our hands together and come up with something worthwhile, because even our numbers and our volumes are good. So I think we can in a very meaningful way contribute to such areas where we have large volumes and large numbers. And clearly, I think all institutions that need to engage in research have to realize it is not something trivial or passing. We need to set aside funds, we need to set aside time, we need to employ people. So it is all of that which is necessary. And I think, at least at our hospital, we are fully aware and we are fully prepared for that. So yes, I do see a partnership very much in the offing.
Thank you so much, Dr. Vijay. To wind up, I would have a question to Dr. Advani. Dr. Advani, based on this discussion, based on insights from your colleagues and your own experience and expertise, how do you think that we could assure equitable access to cancer treatment? Because we are seeing that it is becoming difficult to provide cheap cancer treatment for everyone. So how do you think that is possible in future?
I am telling you, we are already giving equitable treatment to most of our patients. I would say it's a large number of patients. As I am comparing with the people before, they are receiving good treatment, and somehow or other we could always help the patients with our own way from the institute and all, getting it from many NGOs. They can also be supported, and some government schemes also which are helping the patient. So a curable disease, cancer with a curable disease like Hodgkin disease, acute lymphocytic leukemia, there are many other curable diseases. Today, no patient will go without treatment. He will receive the best of the treatment in the world because it's curable. like chronic myeloid leukemia. We have drugs with at lowest cost, and they can be cured by just taking one tablet every day, a chronic myeloid leukemia. So look at that most of our patients are receiving equitable sort of a treatment with the equal results also. Results are also equal. However, I must say that the newer technology which is coming up and which is costly and also it's a rarity, like look at the proton therapy. A proton therapy is available only at one place just now, and I am sure soon in another month or so it will be available at Tata Memorial Hospital as well. That cannot be available to everybody. Every prostate cancer early stage may need the proton therapy, but that's not possible. That does not mean he does not receive the treatment. He receives the treatment, which is equally good and can be cured with the other treatment. So it is we have to ourselves sort of think in our mind that how we can give the treatment to a patient, to a particular patient, which is right for him in terms of the outcome and right for him in terms of the cost. So I think, when you are planning a treatment, you cannot plan a treatment which is out of the hands of the patient's pocket. So I think that is the most important thing. So as a doctor, we are working as a doctor. That's very good. But we have to also work as a social worker, so that wherever we can help, we'll help. Where we know that we have a limitation, we will really give him the best of the advice in that circumstance.
Dr. Advani, I truly admire your conviction that every patient shall get good treatment. Thank you so much for that thought. Dr. Sudeep and Dr. Vijay, you spoke in depth about private-public partnership, and Dr. Advani brought in this whole thought about the personal aspect, how people can actually support in helping others get treatment. Yes, we do understand that latest technology treatment is going to be expensive and may not be accessible to all, but that does not mean that the treatment you would get if you are having cancer will be subpar. So thank you so much, Dr. Vijay, Dr. Sudeep, and Dr. Advani for taking your time out and giving us the wonderful insights when it comes to cancer research in India, and can innovations make treatment more affordable. Yes, innovations in the long run does make treatment more affordable, but in the short run, you and I are also responsible to help others create that, make cancer treatment affordable. So thank you so much for that. And on behalf of Times of India on Cancer Survivors Day, it's been a pleasure to have you at the conclave, which is Living with Cancer, a journey that makes you stronger. So once again, thank you, Dr. Advani ji, Dr. Vijay, and Dr. Sudeep. It's been an absolute pleasure to have you here.